Hello, I'm Dr. Mike Nizzle. I'm a board-certified family physician, and I've been practicing medicine for over 30 years. You know, having patients that are informed and knowledgeable about their disease process usually results in better outcomes. I find that most patients are interested in obtaining this information, however, may not be able to do so due to the technical jargon which is being utilized, which happens in many disciplines, and/or their physician has simply not spent the time explaining the situation to them. It is my hope that these videos help remedy this situation by explaining common health occurrences in everyday language. I hope they help inform you about your disease process and enable you to become more engaged in the situation. Today we're going to discuss high blood pressure, also known as hypertension. First, a disclaimer: of course, any issues that are personal with your health care need to be discussed with your private physician. Healthcare varies on an individual basis, and only you and your private physician can make the appropriate decision for your care. All of the comments I am making today are general in aspect and do not apply to the individual. Well, what is high blood pressure or hypertension, and why are we concerned about it? Of everything we do in family practice, we know that treating blood pressure has one of the greatest positive effects. When we treat blood pressure, we are decreasing the risk of heart attack, stroke, kidney disease, and eye disease. And shortly, we're going to investigate why that is. If you think about your body, you have to transport oxygen to all your organs so they can work, your muscles, everywhere. And oxygen is carried by small trucks, which are called red blood cells. These red blood cells travel along highways, which are called your arteries or your veins. And the red blood cells are pushed along by a pump, which is your heart. So you have a pump and you have hoses attached to the pump. The pump squeezes and pushes the fluid through. When you have high blood pressure, what's happening is the hoses are actually tight. The older term, called hardening of the arteries, is actually a very good term. If you think of your arteries like you would a balloon when you were a young kid, if you blew that balloon up 100 times and you went to blow it up again, it would be really easy. It would be very stretchy. We call that compliance. It's the ease of stretchiness of the artery or the balloon. When you get older, your arteries get hard from laying down calcium, and then the arteries don't stretch. They're non-compliant. It's like a new balloon when you go to blow it up. You can hardly get it to budge. So what happens is the heart pumps, and as the artery gets tighter and tighter, the heart has to pump harder and harder. And of course, if the heart has to pump harder against this tight artery for 20 or 30 years, eventually the pump's going to fail, and you're going to have heart failure. Now, on the other side of the equation, think about taking your hose and turning the nozzle down. You're now turning it into a power washer. So you're taking this high pressure and you're power washing your end organs. And end organs are the organs on the other side of the arteries. These are your brain, your kidneys, and your eyes. So if you power wash your brain, your kidneys, and your eyes for 30 years with high blood pressure, you're going to cause damage. We know that if we can decrease the pressure in the system, then the heart or the pump doesn't have to work as hard, and you're not power washing your end organs. So what exactly do the numbers mean when you get a blood pressure reading? Well, there's two numbers. The first, the upper number, is called the systolic, and the second, the lower number, is called the diastolic. The systolic simply represents the pressure in the system when the heart contracts, when it squeezes. Of course, when it squeezes, you're increasing pressure within the system. That's why the first number is higher. The second number is the pressure when the heart's not contracting. That number is basically measuring the pressure within the arterial system from the compliance or stretchiness of your arteries. If your arteries are very compliant, they're very stretchy, you're going to have a lower diastolic pressure. That's the second number. If your arteries are very stiff, you're going to have a higher diastolic number. We used to focus mainly on the diastolic number. However, it is now felt that both numbers are important, both the systolic and diastolic. There are new guidelines in general now. It is suggested that you have a pressure less than 130/80. Please note that one blood pressure reading does not a case make. blood pressure varies all the time. And so you're basically trying to get an average, or how much time under the curve. If you're sustaining high blood pressure throughout the day because you're under stress, which we used to call white coat hypertension. If it's up in the doctor's office, it's up when you're in traffic, it's up when you're at work. And the more time it's up, the more damage you're sustaining to your system. And so a measurement of blood pressure throughout the day is probably the best way. Your doctor may have what's called a 24-hour ambulatory blood pressure cuff. This is simply a cuff that you can wear for 24 hours. It'll take about 75 readings and give you an average of where you're at. The other way to do this is simply buy a blood pressure cuff at your local pharmacy or Walmart and get a series of readings throughout the day. If those readings are averaging more than 130/80, then you should consider treatment, and you should discuss that with your doctor. What does treatment consist of? Well, basically, there are several ways and mechanisms. We're not going to go into them all as to how you can lower the blood pressure. The main way is if you get the arteries to relax or open up to increase their compliance or stretchiness, then of course the heart doesn't have to pump as hard, and you're saving the heart, and you're also saving the end organs. And many medicines work like this. ACE inhibitors, ARBs, alpha blockers, alpha agonists work that way. Other ways to do this is to simply decrease the fluid in the system. Less fluid, less pressure. These are what diuretics do. And there are also medicines called beta blockers, which decrease how hard the heart squeezes. And if the heart's not squeezing as hard, then of course you're not pumping as much pressure into the system. The choice of the blood pressure pill is between you and your physician. However, the fact of the matter is, if your pressure's elevated, you do need to get it treated, because the studies show us that you are decreasing your risks of the major killers in our society, meaning heart attack and stroke, and preventing kidney disease and eye disease. Now, a question always comes up is, can I change this by lifestyle management? Well, that's a great question. We always advocate lifestyle management. If you're overweight, certainly lose weight, get the salt shaker off the table and start exercising. However, let me warn you that you can do everything right and still end up with high blood pressure. Certain diseases do respond well to lifestyle management, certain diseases don't. For example, with cholesterol, 80% of your cholesterol is made by your liver. So going on a low-fat diet, although great to do, doesn't always solve your cholesterol problem. We have vegans that have cholesterols in the 400 and bad cholesterols in the 200. On the other end of the spectrum, diabetes, type 2, not type 1, responds extremely well to lifestyle management. You lose weight, get rid of the sugar, get rid of the carbs, start exercising, your blood sugar will come right down. High blood pressure tends to be in the middle. It may or may not respond to lifestyle management, but you certainly should do that. Now, a question comes up, if I start the medicine, am I on this for life? Well, not necessarily. Again, it depends where you are in that lifestyle spectrum. So if you're 100 pounds overweight and you're consuming tons of salt and you haven't exercised in 5 years and you're smoking and you change all this, you may see your pressure gradually come down. And so what I'll advise my patients is to continue to monitor their blood pressure. If your blood pressure is consistently running fairly low, if you're getting in the 100 teens over the low 70s or the high 60s, then it might be time to back off on the medicine. And we've had many patients be successful. So starting the medicine is not necessarily a lifelong commitment if you have risk factors that are fairly extreme and can be managed. However, most times when your blood pressure's up, you do end up being on the medication for life. The good thing about the blood pressure medications is we've been treating this probably for 75 years. Medications are extremely well tolerated. Most people don't even realize they're on them. And if indeed you have a side effect, discuss it with your physician, and you should be able to find medicine you can take on a daily basis. So in summary, if your pressure is elevated, if you're averaging more than 130/80, you need to see your doctor and talk to him or her about what's the best treatment for you. As always, it's important to lead a balanced life. Make certain you get exercise, don't smoke, drink in moderation, decrease your carbs and your fat, and get a good night's rest. God bless and have a great day. Thank you.